Increasingly, we have to develop biomarkers to accurately characterize response and resistance as we treat myeloma patients. There are a number of new therapeutic options that are now available in myeloma. Therefore, putting more imaging and serum biomarkers for management of myeloma patients is essential. In this prospective study called LUMIS, we undertook a imaging and blood-based characterization of MGUS smoldering myeloma and active myeloma patients. In the study, we used as an imaging tool a whole body MRI method, which is a standard of care for newly diagnosed myeloma patients. But this methodology is not widely available, partly because radiologists often find it challenging to report and requires double reporting. And therefore, we looked at the validity of the newly described MY-RADS criteria in this study. And we validated the newly reported MY-RADS criteria in the LUMIS study. And this is one of the first validations. The images were accurately characterized by radiologists, 2 independent radiologists, based on the proposed criteria. So this was very helpful in the study. In addition to whole body MRI, we also performed blood-based biomarkers, both to characterize the bone state as well as BCMA, which is a tumor biomarker. We identified BCMA to be a reliable tumor biomarker, and this could be potentially made available to patients as there are more assays coming through. We were also able to accurately characterize MGUS versus myeloma using both serum as well as imaging biomarkers. So this is a pilot study which helps put some additional biomarkers on the table that clinicians can use both in clinical studies as well as in clinical practice in the future.